Welcome, ladies and gentlemen, and we will call the meeting of the Rutherford County Benefits and Insurance Committee to order. I believe you have before you a copy of the minutes of the last meeting. We need a motion concerning its approval.
Motion to approve.
Ms. Boney and Ms. Hickerson. Motion and a second. Did anyone have any corrections or additions? All right, all of you then in favor of that, please say aye. Any opposed? Okay, thank you very much. Now we're ready for Mrs. Stinson to give us an update on the financial condition of our insurance funds.
Okay, if you refer to Report 264, this provides us year-end fiscal reporting through June of 2011. If you go to the second page of that document, you'll see in June that we had a per employee per month basis for medical and dental and vision of $731.23. The year-to-date average was $657.28 compared to prior year, which ended as a year-to-date average of $686.70. We combined the June experience of our Care Here clinics. We were at a total per employee per month insurance plan cost of $780.87 compared to prior year where we ended at $786.43. That we had a reduction of 4.2% in prior year trend from the 2010 year end in June and 2011. So we've had good experience over the past year. Are there any questions on that?
You have a question? Yes. Yeah, we have a question, please. Go ahead.
I just have a quick question. Are we still going to be, I take that back, I'm going to wait for just a minute.
Okay.
Okay.
All right, no problem. Okay, we can go to Fund 266. There's no more questions on that report. As of the end of June on Fund 266, we were at a year-to-date of $972,976.98. We trended a little over prior year. We were able to close out a lot of our old workers' comps in the last year. We currently have less than 20 outstanding worker comp claims. On just a OJI basis, we actually saw it trend downward from prior year on the job injury program, so we were very pleased with that. Are there any questions on that particular report?
Okay. So anyone have any questions on the reports that she just made for us?
Ms. Harvey.
Now, Ms. Harvey.
I'm sorry, now I've got myself together. Going back to the medical and the Care Here clinics and the financial part of that, are we still going to be seeing the Take Care clinics that are about to come into effect? Is that still going to be incorporated in our financial part?
Yes, ma'am.
Of your report? And could you kind of give us a quick update of the Care Here clinics, because I'm receiving a lot of questions.
Sure. We will be incorporating the experience in our on-site clinics ongoing, even under the new on-site clinics, which will actually be called MedPoint, and that's a Rutherford County branded name. In our new structure, just as a reminder, we will actually be retaining the name of the clinics, and the contract has been built such that we can replace the management company without losing providers or losing the name of our clinics. We are on task to close the relationship with Care Here at the end of business on August the 31st. They've been very good to work with during this transition, and we have appreciated the quick response and the time that they've given to us in terms of answering questions and giving us the things we need to aid in the transition. We've had a couple of employee communications that we've sent out via email just initially when the decision was made as a Q&A. A reminder went out not long ago about the transition, and earlier today I actually sent out to all employees the logo that they will begin to see on September 1, the MedPoint logo, which has a tagline of Powered by Take Care. It gave them instructions on how to schedule appointments beginning on Monday, and that will be online only. Effective on September 1, the local number that we'll be using for scheduling will be in effect, and they can actually call a local number to schedule appointments. And there is actually a mailer that's going out this week that's set to begin arriving on Saturday in the homes of our employees that gives them information about the services, the website that they'll have access to, what all is available to them through that website, and general information that will be beneficial through the transition.
Okay, that was a good update. Anything else, Ms. Harvey, on that? Okay, good. Anyone else have any questions regarding the financials? And again, thank you for minus 4.2% trend downward. We expect that again next year.
That's all
We'd
up
like
to
for
the
that to
employees.
happen
That's
again
right.
every year, but that's a difficult assignment, but we appreciate the good things that have happened. Okay, let's see, next then, I guess we're ready for Mr. Dan Good to give us a report on workers' comp and OJI.
Good afternoon. You have should have the report there in front of you. For the month of July, we had a total of 8 injuries in the county requiring medical attention. That brings the total for the calendar year to 139, and you can see the breakdown there at the type of or frequency of the accidents. As far as OSHA is concerned, there's been a total of 95 recordable injuries. Of those 95, 4 of them were restricted days claims. Lost claim days totaled 14, and all others were 36. On the next page, if you look at that, you'll notice that we have the graph that depicts this year injuries compared to the previous 2 years. And you'll see how that looks out and how that's coming out right now. Next page, you'll see that of the total 8 injuries that we had in the month of July, the total incurred dollars was $21,211 for those injuries. The breakdown was the Board of Education had 1 of those 8 injuries. The total incurred dollars for that one was $1,320. And the County General had the other 7, and their total dollars incurred for that was $19,891. And you can see, look at that. Now, for the Public Safety Committee, I added the next page, and of course I've been bringing that to you too, and that is the breakdown of where those claims for County General fall. And on that next page, you can see where those 7 claims came into as far as for the Sheriff's Department, Paul's, and Planning. In addition to that, I wanted to take just a minute, if I could please, and recognize a group of individuals. I don't know how many of you know this, but during the summer months, the 2 summer months, our county schools, and we have 45 county schools, each year during the summer, they actually, during that summer break, they strip all the floors of all the schools, all the classrooms, all the hallways. And if you just go to one of the high schools, take Siegel or Blackman High School, and go look at that school and just see how many floors and classrooms are in those one building, look at what that is compared to 45 schools. And each year during the summer, they strip all the floors and wax those floors. 2 years ago, we targeted, we being Tim Street and myself, working with the custodians and the Board of Education safety people, targeted the task of reducing those injuries. We've had, over the previous years, an average of 11 injuries every summer stripping those floors and re-waxing them. And if you've ever gotten around wax and stripping floors, you know it's like walking on glass, okay? Like I said, in the previous years, they've had an average 11. Last year, we were able to reduce that by 78% from the previous year. This year, I'm happy to say that we accomplished that with 0 injuries. No injuries at all. And I think that is a goal that any custodian, member of the Board of Education, any employee or resident of Rutherford County can actually be excited about. And we're looking forward to continuing that. So I just wanted to take this moment to recognize all the custodians for the school system that's been involved in that. That's an accomplishment that I think is just absolutely outstanding. And know that it's the people on the ground, their awareness and things that they do that can prevent the accidents. So that's all I have. Any questions?
Okay, thank you, Mr. Good,
Thank you.
for another good report, and especially that report regarding our custodians. And I'm sure Ms. Barnes and Mr. Sandvig will communicate effectively to the principals and those custodians of our appreciation of their good work. Let's see, now we've got Ms. Kelly Perrion to tell us about wellness.
Good afternoon. I'd like to give you the wellness report for June and July. The HRA winners were Peggy McGill and Doris Curtis. The Life Services gave a seminar in the health department about team building, and we had 80 people in attendance. The Healthy Cooking for Kids class was in the health department, and we had 13 people in attendance. Care Here Denise Agee did a grocery shopping tour in Publix, and we had 5 county employees attend. Kathy Mead taught an Understanding Your Fitness Center at the Wellness Center at MTMC with 7 people. The Care Here webinars for June and July are listed below, and they had 8 participants during this time frame. Employees are reaching out for help in other ways, not only for these in-session group classes, but through our Life Services online report. Based on recent reports that we got from the online usage, it has had a significant increase in the work-life balance section. We have had I think we're at 20% usage for this quarter. This work-life site includes tips and topics on parenting, aging, nutrition, exercise, communicating with your families, and many different topics for our employees to use. So we're happy that they're utilizing that benefit. Our upcoming activities: on Monday, August 29th, you can go into Gold's Gym and with $10 and get a membership. They are going to waive our fees for that day, our initiation fees, if that's for new members only. We are going to do a walking program where we're pairing up with the UT Extension Office to do Walking Across Tennessee. It's an 8-week walking program. Our kickoff walk is September 8th. We're trying to get team captains in all the schools. We have, I think, 12 team captains, and they're teams of 8 people right now. So we're looking forward to that. It's a 4 o'clock registration and 5 o'clock walk. We have a Healthy Cooking for Diabetes class coming up on September 13th at the Health Department from 5 to 6:30. And we're planning for our Employee Appreciation Day and Health Fair. It's going to be October 15th at Lane Agri Park. Anybody have any questions?
Okay, good report, Kelly.
Thank you.
Thank you very much. Now Ms. Stinson will give us just a heads up on this administrative services bid that we're going to need to start that work on that.
Currently through Cigna, we have an ASO arrangement for medical, dental, vision. It incorporates our stop loss, our prescription drug coverage, disease management, utilization management, and other services associated with the ongoing management of the medical, dental, and vision. Our current contract is set to expire at the end of June 2012, and I am bringing in front of the board for consideration putting that out to bid for an effective date of 7/1/2012.
Okay, she needs quite a bit of lead time. It's a complex process, so she just wants this body to go ahead and endorse her to start the process of putting this ASO, the Administrative Services, out for bid so that we can be in position to evaluate that and have that in place by next July. So if there is someone here that's willing, we'd like for you to make a motion to allow the Insurance Department to start that journey. Mrs. Harvey.
I make a motion that we allow Melissa to go ahead and start that process, but gather the information and put what we need out for the start the process.
Okay, thank you. We need a second. Mr. Hall, any discussion further on that? You'll be hearing more about that as time goes forward. If there's no other discussion, all of you in favor of that, please say aye. Are there any opposed? That is unanimous. Okay. We don't want to leave this early. Surely somebody else has other business. Oh, okay. If there's not any other business, we appreciate your participation. And will we have another meeting next month, you think?
Next month, I have adjusted the schedule to allow us to not meet next month. We'll be sending out a notice on that, but we will be meeting in October.
Okay. Yes, sir, Mr. Sellers.
Would it be possible for us not county employees, we last met in June 23rd, and the mayor amended that on August 11th. Do you think it would be possible to show in the minutes where we forwarded something to the budget committee, forwarded something to the steering committee, as we did in June, that it would show in the minutes what the action was?
Okay, I follow what you're saying. For those items whereby we took some action and forwarded something forward from this committee to budget or to the commission or whatever, to let the minutes reflect somehow that action, is that what you're suggesting?
In parentheses, we might say, passed, moved by the committee, whatever.
Okay, well, most of the time our stuff goes to the budget committee for the next approval process, so we could make that happen, yes. All right, so Ms.
Ms. Anderson will add that to the
Anderson
process.
can reflect that in the minutes, so we'll make note of that to remind ourselves that when action is required at the committee level, that we report what the results of that was. Anyone else have any suggestions? If not, then this meeting is adjourned. Thank you very much.